Hi, my name's Matt. I'm an A&E doctor who used to work at Princess Alexandra in Harlow, and when I was there I started a project called Fem Feedback, the aims of which was to help our colleagues in the ambulance service to find out what actually happens to their patient after they hand over their care to someone from the hospital. We engaged with the patient panel, and in particular Shahid and Anne have been absolute stars. We went to them with this problem, we sat down, we spoke to them, we explained what our concerns were about the current way things go, we explained our aspirations for what we wanted to achieve, and they listened carefully and they did their best to understand the problem and really get to grips with where the difficulties were and why specifically it was we needed patient information. And once they felt like they understood that, they were just so supportive and they made such an enormous difference. Not only did they help locally by being able to reassure our hospital that they had reviewed these practices, but it went further and they engaged other patient advocacy groups to try and make sure that they were also supportive. And collectively, this patient representation evidence was something that we could submit to the Health Research Authority Confidentiality Advisory Group. And this evidence was a major reason why we are now able to safely and appropriately disclose patient information without consent to the ambulance service on a case-by-case basis that's carefully scrutinised, so that our communities are served by ambulance service and air ambulance service personnel who fully understand what it's like to have managed patients just like them in the past.
Hello Anne and all of the patient panel. May I just say an enormous congratulations on your Queen's Voluntary Service Award 2021. It's the highest accolade for volunteers and charities, and it's so deserved. It's an outstanding achievement and I'm so proud of all of you. But it's just so deserved. From the day that I interviewed you, Anne, I knew you were the right lady for the job. You were exactly what I was looking for to inaugurate and lead a patients panel. And all of the patients panel, you have never stopped challenging. You are professional and the archetypal critical friend, providing constructive challenge to the board and to everybody in the organisation. And that is the only way any organisation can actually improve. And I know all of my colleagues at Princess Alexandra really do value your efforts and endeavours to bring the community of Harlow and surrounding villages into the hospital so that you can co-design. Your work is dynamic, it's creative, and I have to say that without your dedication, grit, determination, and you're like a rat up a drain pipe, Anne, on everything, which is exactly what we need you to be, Princess Alexandra Services for patients would not be where they are today. You are all an incredible group of individuals. You are so committed, and I feel most privileged to have been part of the inauguration of the patient panel at Princess Alexandra. So congratulations. And I miss you all. Bye.
Hello everybody, warmest greetings from NHS Scotland. I'm delighted to be part of the celebrations with you all, and a huge congratulations to each and every member of the patient panel on receipt of such a prestigious award. You're now truly my claim to fame. But seriously, I have had the privilege of working with many of you during my years of service at PAHT, and I have always been struck by the level of energy, commitment, passion and drive that each and every one of you have displayed in improving the care that we deliver and the experience of our patients and service users. I was privileged to be invited along with the patient panel to speak to a patient conference at Ipswich Hospital, where our patient panel members demonstrated the length and breadth of all of the activities that they have been involved in across our organisation. And I clearly remember the conversations that ensued thereafter about the level of organisational response to the activities that the patient panel members were involved in, the level of detail that the teams were involved in, and ultimately the impact that this was having on the wider organisation. And it is lovely to see how not only the patient panel have shaped the care across our organisation, but are supporting others to do so. I also remember the conversations that myself and Anne had when we had some very challenging times in the emergency department. But actually, at the heart of those conversations was always two questions. What can we do for our patients, and what can we do to support our staff to deliver the best care? So this award is truly well deserved for you all. Congratulations and take care. See you all soon.
It's a pleasure to talk about Patient Panel. I have been working with Patient Panel for over 5 years, and it gives me immense pleasure to be working with them. This also gives me an opportunity to see the services provided by the Trust from the community perspective. Anne and I campaigned for the lack of chronic pain services provided for the local community. By the Trust. Our joint campaign has been a long road, but eventually culminated in the formation of a community pain service. We call it CPS. Is now available. However, I still believe this service needs to grow further to meet the existing demand of the local community. Our patient panel is a very well-led group. Our patient panel is a very well-led group under the mindful and selfless leadership of Anne. Anne and Diane put in their own valuable time and effort to make this group very cohesive, which gives a voice for the local community. And the hard work of both Anne and Diane from Patient Panel brought the colorful success of recognition in the form of the Queen's Award for Voluntary Services last year. Sahid has been very valuable and good compliment from the Trust in supporting the Patient Panel. Sahid's silent and relentless support, in my view, made a huge difference to widen the support platform. Sahid's innovation and willing to help spirit was fantastically demonstrated during the first and second wave of the pandemic and was very well appreciated by the clinical and the patient community. I think our patient panel is a very dynamic group who are constantly engaged in helping the Trust in refocusing on the need of the patient and community at large.
Hi everyone, my name is Dr. Curtis Imodi. I was one of the emergency medicine consultant at the Princess Alexandra Hospital. I want to say a very big congratulations to the patients panel for their achievement in receiving the Queen's Award for the voluntary service that they do in the community. I really wish I was there to celebrate with you guys. I vividly still remember the times I worked with various members of the patients panel. Like I remember when Anne came to spend the day in the emergency department supporting the staff and the patients. I also remember the various meetings we've had to make sure that the patients receive a better experience when attending the hospital in various departments. I also want to just say thank you for this opportunity to send this message. I miss you all, and please continue to do the amazing work that you do. Congratulations once again. Thank you.
I wish I could be there tonight, but sadly I had a clash. The choice was between dressing up in a weird way on Friday evening and recording this, and being able to be with my family for the occasion of Eid on Tuesday evening. And I'd love to be in both locations at once, but I think I've made the right choice and decided to spend some time with the family, as all of us should in the NHS. Thank you very much, and I hope you enjoy and have a lovely evening at Downhall.